All right, so we plan on transferring our patient from just a normal patient room down to the ICU. So I'm gonna go through and check their chart, find out any information that I need. Then I will gather my supplies. We are just gonna use a oxygen e-cylinder just for the transport down. So when gathering my supplies, I will have since it's an e-cylinder, it's a small tank, so we'll have a PISS safety system. Before applying the regulator, we'll check to make sure that the nylon washer is there, kind of a safety check. We'll crack the O2 tank to remove any debris. And we'll attach the regulator. And we always want to make sure that we're like transporting any tanks in a cart, or we have them attached to something so they're not able to tip over for a risk. Any patient on oxygen should have a no smoking sign, caution signs. We just want to make sure we're just handling the tanks safely. We will be transferring them down there with a simple mask, just for patient preference. Their nose is kind of irritated, so we've been switching over to the simple mask. We can attach it here. We can turn on the O2 tank. There wasn't any sounds coming out, so that means the regulator is placed on correctly. We don't have any leaks. Then we can turn on the flow a little bit, and we do hear oxygen coming out. It's at roughly under 1500 psi, so that should be plenty enough to get us down there. So go into the patient's room, knock, enter, identify yourselves, what we plan on doing. We're transferring to another room. I could do a pre-assessment vitals before transferring them down there. Kind of get them positioned. We'll apply the mask, adjust it to make sure it fits properly. And the order was for 6 liters per minute. So then we can transfer him into a wheelchair, and we can move the tank over to like the wheelchair kind of cart. And then while we were transferring him down there, his SpO2 stats dropped down to 70%. And so when getting down there, we'll transfer him into the bed, and using a Thorpe tube and a non-rebreather mask, we'll just connect it here, and we'll turn it up to 10 liters per minute, just to kind of help raise those O2 levels, as well as get a more higher FiO2 level. So when doing that, we'll just make sure the bag is completely inflated. If it's not inflated, we'll just raise the liter flow. We'll kind of do like the post-assessment vitals, monitor to make sure those like oxygen levels are rising, and then we were able to, if his levels are back normal, we can switch back over to a simple mask, just depending. Make sure we always ensure safety. We won't trip over the tubing. There's no leaks coming out of the Thorpe tube. And then once we're all finished, the patient's levels went back to normal, so we're all finished with our work. We'll go through and chart the different vital signs, what happened, kind of the post-assessment, and then we're able to return the tank or the cylinder back to where we found it. Turn that off. Then regulator off, and we'll place it back in the correct storage room with the correct signs, the oxygen, that it was placed in another cart, and that the hazard signs are in place.
Awesome.